Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thanks for joining us. I'm going to be speaking with Dr. Dan Carlin, founder and CEO of World Clinic. He's joining us on the program to talk about the services provided by World Clinic and how they're helping save lives during the COVID-19 outbreak. He's also going to tell us how he remotely saved a patient whose heart had stopped by using his iPhone. Welcome to the program, Dr. Dan Carlin. Thank you for taking the time this morning.
Oh, thank you, Neil. I'm glad to be here.
Well, tell us who Dr. Dan Carlin is. What type of patients do you treat? Are you a medical doctor or a PhD? What's your background?
Sure. Well, I've had an interesting route in my career in medicine. I was initially a surgical resident at Bethesda Naval Hospital. Then I spent 2 years on a warship. Finished my obligation to the Navy. I spent a year overseas on the Afghanistan border during their Russian war in the 80s. Came home, got boarded in emergency medicine, and in the mid-90s I started a very simple telemedicine practice for ships. This was a world that I understood quite well, obviously. And my timing was fortunate because it was just the very beginning of the internet, and I was fortunate in that I ended up being an early adopter of the internet, mostly because my distant patients on ships and islands were telling me to use this new thing called email. So there I was in 1996 using email to take care of patients very far away. Obviously, since then it's gotten a lot more interesting, but that's where I came from as a physician.
So how did you end up founding World Clinic, and what's the overall goal of the company?
So World Clinic is essentially it's a medical practice that started now almost 20 years ago, and it's an interesting medical practice. I'm the founder, and the very basis of the medical practice was telemedicine. So 20 years ago, telemedicine was just email and phone calls, but that was how we took care of a distant ship or an island or a population that was removed from, conventional healthcare. So that was our point of origin, and it became the basis of the practice. Now, I'm happy to report that the technology has improved dramatically, obviously, since then. In 2020, we now have almost everyone with a smartphone on them, which is essentially, in relative terms, a supercomputer relative to where I came from. And we're now at a point where, because that was our origin, we've transitioned from being sort of a telemedical emergency room to being that plus a much broader scale medical practice. So we're doing a lot of primary care, obviously tons of urgent care, so a lot of organized prevention now. And even now in the last 2 or 3 years, as we've built out our physician staff, we're starting to do a lot more chronic disease management. And for this, I have to thank the folks at Apple and in the technology community that they're enabling guys like me and my colleagues to track chronic diseases like atrial fibrillation, diabetes, hypertension, depression, using iPhone apps. And we're developing a whole new model around chronic disease management that's actually infinitely more efficient than the old model of the periodic office visit. So there's a lot going on, but the big story is we started out with acute care, and now we're doing that plus a lot more primary and preventive care.
So it would seem that you all have been prepared for this. You'd be more in a position to be prepared for something just like this COVID-19 pandemic, where social distancing is now, I'm not going to say the new norm, it's the norm. I don't see us going back anytime soon to, not social distancing the way that we were. So you all have been on the cutting edge of this technology, telemedicine, telehealth for years.
Well, thank you, Neil. I appreciate you saying that. When I started it, I could see the potential of what this was going to become. It was a little bit disappointing because when I was interacting with the conventional healthcare system, there was very little interest in telemedicine because there were not billing codes that paid for it. And also, when you do a good job with prevention and primary care, there are a lot less procedures and expensive care events. So I think hospitals had sort of mixed feelings about what we were doing, especially from the economic side. Now, ironically, COVID-19 has changed completely. The entire dynamic has changed. We were never built around an office visit as the primary form of interaction. Mm-hmm. And as a result, we were infinitely better prepared for this than most folks would be with a conventional healthcare. We already had a model that was built on easy physician access, scheduled appointments, and care team that was supporting all the logistics of this. So I would also tell you, given that we have a lot of patients scattered around the world, we spend a fair bit of time sort of tracking things like COVID-19 and SARS and the MERS virus, because that's actually part of our practice awareness. Like you kind of have to know that stuff. And so we saw it picking up a little momentum in December and January, and we were informing our patients by early January about travel and to be a bit more mindful. And we've subsequently started a weekly and just a very quick video clip from our medical director, Bill Lang, where he's interpreting everything that's going on. But yeah, thanks for saying that. We were, by the nature of our practice, we were much better prepared for this than most folks were.
How much has World Clinic been involved in consulting other facilities, other healthcare providers who may be just now getting into, maybe just now touching telemedicine at such a crucial time when you have to really get on board and become accustomed or trained very quickly? How have you been offering help to those who may not be nearly as up to speed as World Clinic?
Well, it's funny you say that. A very, very large medical system reached out to us last month, and we've begun a conversation with them about how could they adopt some of the elements of our practice inside. And this is a huge, huge medical system. But I think that they're aware that with telemedicine, the cat's out of the bag now. Practitioners are using it because their offices are closed. Patients are getting used to it because they need to have some element, at least some basic elements of their care continue. So a lot of the historical misperceptions or prejudices are falling by the wayside now. And it's ironic because there's there's a number of telemedicine practice software platforms, but historically there's been no practitioners other than ourselves, and there's probably one or two others in the country in more rural areas. So we're ready to do this. There's an industry that's ready to be unlocked by COVID-19. The software's there, the devices are there. Now we just have to put the patients and the physicians and practitioners in place. And I think that's going to happen. I mean, this recent conversation was in direct response to COVID, but I think an awareness across all of healthcare that telemedicine's arrived. It's not going back into the shadows or the margins. It's going to become a center point of most people's healthcare and where they're going to see it organized and accessible. So it's an exciting time, and I have, on a personal note, I've probably had 12 colleagues call me in the last 3 or 4 weeks saying, how the heck do I do this? Mm-hmm. And it's been kind of fun saying, okay, here are your basics, and I take them through a checklist. And seeing their attitude change from one of resistance or fear to, oh, heck, I can do that. I just got to get this organized in a new way. I've got to learn a little bit of tech, but not too much. So it's a good time. I mean, it's an exciting time for all of us that have been in telemedicine now for a while.
If you would, Dan, put telemedicine, telehealth into perspective for us. You remotely assisted a person who had, I guess, was suffering a heart attack via your iPhone. How did that happen? Talk about that.
So great. That's a great story. So we take care of a construction workforce. Mm-hmm. It's actually down in Florida. And I was on call Friday afternoon about 6 weeks ago. And a safety officer called our hotline. I took the call. He said, I've got a man down. I said, good, let's go to FaceTime. So we went right iPhone to iPhone FaceTime. And so I'm on video with the safety officer, and he's running across the parking lot. And there's a man collapsed on the ground, and there's 2 young men doing CPR on this gentleman. So I'm on FaceTime. I'm looking at this event. They're doing CPR. And I say to the safety officer, where's the defibrillator? And he says, it's in the office. I said, send the fastest kid you have back to the office. Get the defibrillator. In the meantime, I'm basically coaching the two kids that are doing CPR. One's doing good compressions, the other's got the person's airway open. About a minute and a half later, we get the defibrillator there, and I take them through, because they've never used a defibrillator before. I take them through putting the pads on, and sure as heck, the defibrillator says, reading rhythm, and then it says shock advised. And I remember this so vividly. The one young guy looking up at me with fear in his eyes, like, what do I do now? And I say, stand back from his body and push that green button. And of course, it defibrillated this fella that was down. And about 30 seconds later, we were just about to start CPR because we couldn't really get a good pulse, but I think there was some fear involved.
Yes.
Anyway, the paramedics arrived, and the paramedic ran over, and he quickly checked for a pulse, and he said, "Stop, guys. He's got a pulse. He's got a very slow pulse. Hold on 1 second." And sure as heck, he regained his pulse, and they rushed him off in the EMS unit. They actually picked him up by helicopter en route to a regional medical center, and they took him to a cardiac lab. He had a rescue angioplasty, and that gentleman survived and walked out of the hospital talking. He had no memory of his cardiac arrest, but otherwise was neurologically almost perfectly normal. So that's the new normal, Neil. Physician presence. If there's an iPhone, there's an opportunity for physician presence.
Absolutely.
Right at that moment, right at that event. So we're living a really exciting time, because I think there's going to be a lot more of those moments now in the future.
Give us a website where we can learn more about World Clinic.
Sure. It's very simple, worldclinic.com. We have a new website going up this Friday, May 8th. So if folks, they can see the old website. It's got a ton of information. The new website's much better looking. I'll say the old website was designed by a bunch of doctors. The new website's designed by people who know what they're doing. So it's got a lot of information, a lot of good stories, and in essence, it describes a vision of where things are going. So I highly recommend it.
Dan, thank you for joining us here on Health Professional Radio this morning. Been a pleasure, and I'm hoping we'll talk again.
All right. Thank you so much, Neil. This has been fun.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Dan Carlin. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.